So I'm just going to keep admitting people as they join. So this is the bloodborne pathogens for parks and open space, public works maintenance in 2020. And so I've got some new data, some new pictures, new material. So we're just going to go over it real quick. If you have any questions, just chime in and we'll go from here. So, all right. So we're going to start off with hepatitis A as normal. And hepatitis A is a highly contagious short-term liver infection caused by the virus. And people who get Hep A may feel sick for a few weeks or months and then recover with no lasting damage. In rare cases, it can cause cirrhosis and people can die, but not very often. How common is it in the United States? So 2018, that's the most current data we've got so far, is 12,474 hepatitis A cases in the United States. And so the actual number of cases reported is probably closer to 24,900, they say. As in 2020, there were no reported cases in the state of Oregon, so that's good. At least that got to the public health. So, okay, come on. So how's it transmitted? It's found in the stool and the blood of people who are infected. You can see this is the end effect here of the person's yellowing of the eyes and yellowing of the skin. So the virus is spread by someone who ingests the virus, even small amounts to see, through person-to-person contact, which is personal contact within certain types of sexual contact, caring for someone who's ill, drugs, other things, or eating contaminated food, which is the most common that we have seen around the state of Oregon, even around Eugene when there's been an outbreak. So that means somebody, a food preparer who has hepatitis A, goes to the bathroom, doesn't clean their hands very well, comes back, prepares your food, and then you ingest it. And so that's pretty much it. So in 2018 for the state of Oregon, 23 cases of acute hepatitis A, 9 cases were from people who ventured outside of the state of Oregon and came from other countries. And so 4 cases were reported from men having sex with men, and no cases from homelessness or injection of drugs were reported. So 5 cases had no identifiable way to identify how it happened, and 26% of the cases were under 40 years of age. So, you know, it's not a big deal in Oregon, but it does happen on occasion. And so we always just want to make people aware of that. So going on to the next hepatitis, which is B, which is the more common. This is a preventable viral disease that occurs in the liver when an infected person passes through blood, semen, or saliva, or bloodstream of a non-immune person. So how much, again, in the United States, there's about 3,400 cases of acute hepatitis B reported to the CDC, and 1.1 cases per 100,000. And so I just found this out, say after adjusting for under ascertainment, they figured there was closer to 22,000 cases in the United States. And so Lane County sees about 5 to 6 new cases every year. So you just got to be aware of when you're cleaning up stuff and having contact with people, that just be aware of. It's not very prevalent in Lane County, but it still is out there every year. So we just have to be aware of that. So again, how's it transmitted? Mostly through puncture through the skin, mucosal contact with infectious blood or body fluids, which is semen, saliva. So having sex with an infected partner, injection, drug use, syringes, that kind of stuff. It can come from a mother into the fetus and then passed on to the child, and contact with blood from open sores or an infected person. So exposures to needle stick, sharp instruments. So that's the biggest concern, obviously, is getting poked or getting cut or having a puncture wound. So they even found it with mucosa membrane, so in the mouth. So razors, people sharing razors, toothbrushes, or glucose monitoring equipment. So if people are sharing that, then that's a potential mode of transmission. So again, not very prevalent in Lane County, but still is out there. So we talked about this a little bit before. So infants born to infected mothers, sex partners infected, men having sex with men, people inject drugs, household contacts, healthcare, public safety workers. So you guys would fall into that, the public safety, exposed to blood and contaminated body fluids. And so people on hemodialysis also can have it. So it's out there, just got to be aware of it. So the signs and symptoms is somewhat similar to the flu. So fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, clay-colored stool, joint pain. So the biggest thing is jaundice, turning yellow of the skin, then the eyes turn yellow. So that would be down the road, probably 3 to 4 months after being infected. So if you've had the vaccination for hepatitis B, it's highly unlikely that you would contract that. So we have a whole mechanism if a person gets exposed to that. So again, the state of Oregon in 2018, there was 403 new cases reported in Oregon, down from 490 in 2017. 39% of these were women who diagnosed earlier than men due to prenatal screening. Among women at childbearing age, 39% were pregnant, and 79% of the cases reported in their country of birth were born outside the United States. So again, not a lot in the state of Oregon, which is good. And here's a little PSA for Hep A and Hep B. So it's about 4 minutes long.
If you have hepatitis A or B, your liver is inflamed because you have been infected with either the hepatitis A virus or the hepatitis B virus. Your liver is a soft, flexible organ that performs many important functions. The functional parts of your liver are called hepatic lobules. Your hepatic lobules filter all of the blood in your body. As the blood passes through, your hepatic lobules break down harmful substances. Remove bacteria and worn-out blood cells, and forms clotting factors that control bleeding. After a meal, your liver stores nutrients to provide your body with energy when needed. Your liver also makes a substance called bile. Your gallbladder stores bile and releases.
Come on.
The virus entered your body when you were exposed to fecal matter from a person infected with the virus. You may have been exposed to the virus by eating contaminated food or water, contact with infected feces, such as during a diaper change, or having unprotected sex with a person infected with the virus. If you have hepatitis B, the virus entered your body when you were exposed to the blood or other body fluids from a person infected with the virus. This could have happened from sharing a drug syringe with an infected person. Other ways you may have been exposed to the virus include having sex with someone infected by the virus, sharing personal hygiene items such as razors or toothbrushes used by an infected person, direct contact with the blood or body fluids of an infected person, or when a mother passes it to her baby during birth. When either the hepatitis A or B virus enters your liver, it invades your liver cells and makes copies of itself. In response, your body sends immune cells to attack both the virus and liver cells infected with the virus. As a result, these liver cells become inflamed and then die. Over time, scar tissue forms around dead and infected liver cells, which prevents your liver from working properly. If you have a chronic hepatitis B infection, your liver contains a large amount of scar tissue called cirrhosis, which limits blood flow and results in permanent shrinking and hardening of your liver. If you have hepatitis A, your doctor won't prescribe any medical treatment because your immune cells will eventually find and destroy all of the hepatitis A viruses in your body. If you have hepatitis B, your immune system will usually remove all the hepatitis B viruses from your body. In some people with chronic hepatitis B, particularly children, their immune cells are unable to remove all of the hepatitis B viruses. If you have chronic hepatitis B and your immune system can't get rid of the virus completely, your doctor may prescribe antiviral medication. If you have a severe case of chronic hepatitis B, your doctor may recommend a liver transplant operation.
Okay, so that just gives a brief overview of that. So that was A and B. So we have vaccines for A and B, and so I'll talk about that at the end. But it's highly recommended that anybody who works in and around wastewater, anything to do with cleaning up camps or out in the sewer system, that you get both hepatitis A and hepatitis B vaccinations. Okay, as far as hepatitis C, that's the third one in the chain of the hepatitis, and it's found in persons who have typically 15, 20 years to develop. So this is a very long-term developing disorder that based upon things that people may have done, 20 years ago, it may come back and then start to develop. So again, looks like hepatitis A and B, the jaundice, fatigue, dark urine, abdominal pain, loss of appetite, nausea. So the typical things that have happened, adults born between 1945 and 1965. So basically the baby boomers are the highest ones at risk of this. People who had dialysis or people who had a blood transfusion before, I think it was 1992. We had one employee that they had a transfusion and they ended up with hepatitis C. So that was before they screened the blood. So in the United States, again, there are 3,600 cases, acute hepatitis C, and after adjusting again for under ascertainment, as they talk about, or under reporting, it's estimated that about 50,000 people had hepatitis C in 2018. As far as nationwide, it's pretty big, about 2.4 million people in the United States living with hepatitis C that's only 2013 to 2016. So it's one of those things that is slow growing, and then people start to feel not well. They go see their doctor, they'll do a blood test, then they may do further testing for the liver, and then determine that a person has hepatitis C. There is medications that can be taken now that can eradicate, well, up to about 95% eradicate hepatitis C. So it's something that can be managed very well if a person develops hepatitis C. So here's a big kind of a recap for A, B, and C. And so it's A is fecal and oral route. Hepatitis B and C is both blood and body fluids. Prenatal transmission, no for A, yes for B and C. And then just a laundry list of things that talks about it. So it talks about acute number of infections reported. This was 2017 adjusted. So it's just out there more. And unfortunately, I couldn't find anything for Lane County. Well, I found a few things for Lane County, but not much. And so that's a recap for that. As far as in the state of Oregon, I did find this. This was in 2018, 5,400 people had chronic hepatitis C that was reported. And so there's quite a underreporting, as always, and everything like this. So it's infections about 157 per 100,000 in males and about 102 per 100,000 in females. And so again, the vast majority of people between 1945 and 1965 that were born during that time. Okay, so moving on, let's do a little, this was a pretty good one for hepatitis C.
It loves the dark.
It lives in the shadows.
It waits for the unsuspecting.
Without warning.
It preys on the unknowing.
Without symptoms.
Already, hepatitis C
has killed hundreds of thousands.
Hepatitis
C.
A virus now 5 times more widespread than HIV.
But most never even see it coming.
It's time we all see hepatitis C for the hidden killer it truly is.
By exposing the truth.
By sharing the word.
By caring enough to act. Act now.
Act now.
Make sure you're tested.
Your friends are tested.
It's time to look out for each other.
It's time to see our way through hepatitis C.
For good.
Forever.
For a million
For
reasons.
a million reasons.
The millions of lives we can save right now. Go to helpwithhepc.com and join the Spears Foundation's efforts in exposing the truth about hepatitis C.
All right, so that was a good just PSA for hepatitis C. Okay, moving on to HIV and AIDS. So spread through sex, sharing injection equipment, or receiving transfusion or transplant from an infected person. It also can be spread from mother to fetus. and so that to infant at time of delivery or by breastfeeding. And so it says HIV spreads by inadvertent exposure to bodily fluids in infected persons, such as a contaminated needle in a healthcare worker. So that's rarely. And so, you know, I keep track of this stuff, and you don't hear about that much or hardly at all people who are doing their normal everyday activities and getting exposure to HIV or to any of the other ones for that matter. Okay, it's just some talking about ending HIV transmission. So there's about 154,000 people who have HIV and don't know it in this country. About 37% who know they have HIV don't have it under control and need treatment, and 4 in 5 people who could benefit from medicine to prevent are not getting it. So it's still an issue out there, and still we need to deal with it as a society. And so just making people aware is a big factor. So here's a brief, again, HIV and AIDS. This one doesn't have any sound, so just words. Okay, so now it's going to move on to some other things, and outside of the realm of hepatitis and HIV and AIDS. So pertussis is a highly contagious bacterial infection from the respiratory tract. So transmitted from person to person through respiratory secretions. So coughing, sneezing, spitting, things like that. It's most severe in infants and young kids, but many of whom suffer, it's that whooping cough type thing. There is a vaccine that's recommended for all adults. So after the age of 50, or if your doctor recommends it earlier, is to have another Tdap, what's called tetanus, diphtheria, and pertussis. So tetanus is something that we need about every 10 years, and especially for people who are working outside or working around dirty tools and things like that, it's a good idea to have that done every year. We don't see diphtheria very much anymore, but pertussis, it's worse if it's seen in adults, and so there's certainly a vaccine that if people want to take that's up to you. And let's see, this was up in 2018 with 500 cases reported. Lane County was hit hardest with 227 cases in a community-wide outbreak. The incidents statewide were highest among infants. And then, so it does happen, and we've had a couple outbreaks over the past few years in the state of Oregon, and where it gets, some child gets it and they pass it on to other kids, and then they pass it on to their parents. So it's just something to be aware of. Tuberculosis, TB, it's a communicable disease. It's another bacterial that affects the lungs, and so it's all spread by sputum and sneezing, coughing, spitting, things like that. So it's got to get into the air, and you have to inhale it into your lungs. And then if you inhale enough of it, then you could develop TB. And there is medications that can deal with that. So it's something that can be managed, but it's just being cautious about around people who are coughing pretty hard, and coughing sound like they're coughing up their lungs. So as far as Lane County goes, you can see that we're in the green here, and this is 2018, so this is the most current data. So there's 3 to 5 cases per 100,000 in Lane County, which last I've checked, there's about 370,000 people in Lane County. So that's anywhere from 9 to 15 cases in 2018. So then that, again, that's what gets reported to the health department. So if people are just living with it and dealing with it, and then not getting it treated, then we don't have it recorded. So again, not a lot in Lane County, but it's still out there, and we need to be aware of it. On to influenza, and the influenza certainly is taking a back seat to COVID these days. And so you can see we're kind of in this light, Oregon's in the light green. So this is as ending April 18th of 2020. So very recent data. We're in the minimal category, and I haven't heard very much about influenza lately, and haven't read any statistics that, we have a good vaccine that we offer every year to employees and family members. So that's something, if you want to take advantage of that, we'll be advertising that in the fall and getting that going again. So not much with influenza. Meningitis is, we don't talk about it much, but it's still out there. And this is showing some of the skin lesions that can happen from the meningococcal disease. And again, it's going to be spread by toothbrushes, cups, spit, sneezing, all the kissing, all the things like that. So the last outbreak was up at the University of Oregon. I think it was a couple years ago, and they vaccinated most of the students if they wanted for that. So it's something that typically you don't see a lot of, but it can be serious and can cause septicemia, which is infection of the blood, and then that's a big deal. So if somebody gets it within 3 to 7 days, there's a sudden onset of fever, a headache, and a stiff neck. So the stiff neck is the real sign there that something's not right. And then additional symptoms of vomiting, nausea, sensitivity to light, and altered mental status. And so again, it's just be aware of that. It's out there, and we haven't had much of it this year, but there was an outbreak a couple years ago. And this is from 2009 to 2018. There was 32 cases in Lane County. I checked all these counties when I was looking at this, and we had the highest number of cases in the state was during that period of 9 years. So again, like I said, it's out there, and just being aware of it. E. coli, we don't talk much about E. coli, but it's certainly still out there. You get it by coming in contact with feces or stool of humans or animals that are infected. And when people drink water or eat food that has been contaminated by feces, which hopefully that's not happening, but it certainly is out there, or meat that hasn't been processed correctly or hasn't been cooked to 160 degrees. And so we were looking at that magic 155 to 160 degrees, and that's internal temperature. So if you have a meat thermometer, you can stick it inside and just make sure that it's cooked. And then, so this is something just to be careful about, especially when we're out with barbecues, or if we're going outside and having food left on tables for a while, and then just being careful. Raw milk or dairy products have known to have E. coli in it, so check the labels for pasteurized. So if it's been pasteurized, then there's a good chance there's probably not going to happen. That destroys the bacteria. Raw fruits and vegetables, lettuce, alfalfa sprouts, unpasteurized apple cider. There has been cases I've read that have been passed through that just by drinking some of the raw stuff. So again, you just have to be careful. And lakes, pools, water supplies. So just be careful if you're drinking out of a river or something like that, or a lake. If you don't have a way to decontaminate it, just be careful with that. Okay, talking about camp cleanup now. So I know some of you are involved with that, so I want to talk about this, then we'll get on to some COVID stuff. So the dangers are, obviously there's lots of dangers: human waste, animal waste, cleaning that up, needles, the 3 forms of hepatitis, HIV, MRSA, E. coli, and TB are all things that can be out there for being aware of that when you have to clean up spaces. So not that you have to wear this kind of full body protection uniform, but just you want to wear what makes you feel comfortable when you're cleaning up this stuff, and then clean the clothes you're wearing definitely well after that. So here's some stuff not talked about very much. This leptospirosis is a bacterial disease that may lead to kidney failure, meningitis, and encephalitis of the brain. So this is, again, it's a bacterial, so it can come from any sources of animal or human waste that's out there. Salmonella is out there. This disease is caused by consuming water contaminated by rat feces. So obviously with the non-house group, there may be dealing with rats and stuff like that. And lately we've seen a little uptick in typhoid fever. We've seen this in some police officers dealing with some non-housed or unhoused people. And so because they're eating food and the rats are running around, stuff like that. So different kinds of allergies, from the droppings, the dander, and hair can cause you to sneeze and have other reactions. So just be aware of that. I can't even pronounce all that. So it's a viral infection disease that's transmitted through saliva and urine of rats. So again, rat feces, rat food, rats been eating food, hemorrhagic fever and renal syndrome. So this is something we don't see very often. But again, all this stuff can be passed through rats and through their feces, and through, if they're eating food, then a person's eating their food as well, can be passed on. So you have to be aware about that. And so the last slides will be about COVID. And so this is what's taken up everybody's time these days, and the media and all that kind of stuff. And so just some facts about it. It's a respiratory illness. So just, that means it's got to come in. You have to breathe it in, or you have to touch something that has an active virus on it, that you touch your eyes, or our nose is a dry mucous membrane, so it's going to be more difficult to get that in. But we have to breathe it in. It's got to, then it affects the lung tissue. So it's from what they call the coronavirus family, which we had a few years back. There was the SARS outbreak, which certainly wasn't as contagious as this, as COVID-19. So it happened since December 19th. And so there's a lot of stuff that's still being learned, and they're going to see a lot of stuff that's talked about on TV. And so they're still working on a vaccine. They're still working on trying to figure out ways that can help people not get it. But it's certainly something that's out there and we need to be aware of. So how is it spread? It's spread from person to person through respiratory droplets produced when an infected person coughs, sneezes, or talks. So when this picture of the sneeze, they've recorded sneezes coming out at over 100 miles an hour. And so if somebody doesn't cover their mouth, then that sneeze can float around in the air. And if the HVAC system picks it up, it can transmit it through the HVAC system. And so just if you're outside and dealing with people, just be cautious of the distance. Obviously, the physical distancing we're looking at is 6 feet. And there's been some more recent stuff talking about 8 to 12 feet being more safe, which would make sense. So, and then we also know that can be passed from people not showing signs. And that's the scary part, is so nobody really knows, somebody who doesn't have a fever, doesn't have any symptoms, how long they can shed the virus and things like that. So again, there's a lot that's not known yet. So, or touching an object with the virus on it. And so the typical symptoms that we're seeing now people get is a cough, chills, fever, sore throat, muscle pain, shortness of breath, and a new loss of sense of taste or smell. So those are the classic signs and symptoms. And so the cities put out stuff, it comes out weekly from the execs, and that if people are feeling sick, they need to stay at home and stay quarantined for the 14 days to make sure they're going to be okay. So those are things to watch out for. And so how severe is it? And so it's obviously very severe because it's affected so many people in this country, and a lot of people have passed away because of this. So it's so far the deaths from COVID-19 in Oregon, I've been following this stuff daily if you haven't been, that it's the vast majority, I think it's over like 90%, are people who are over the age of 60 that have underlying health conditions. So if you're family members or you have underlying health conditions, then you have to be much more aware, and make sure you're wearing your mask and things like that when you're out in public, and just being safe, washing your hands frequently. So it is highly infective, and there's a lot that's not known. And this stuff I'd found on WebMD. So again, just take it for it's done in the laboratory. So they talked about metal objects, doorknobs, jewelry, silverware. It can live up to 5 days. And so on wood products, furniture, decking, furniture, up to 4 days. And then plastics, milk containers, detergents, things like that, any kind of bus seats, backpacks, elevator buttons, 2 to 3 days. So stainless steel, refrigerators, pots and pans, up to 2 to 3 days. Cardboard, maybe 24 hours. So any kind of cardboard material. Copper, they even tested copper. So pennies and cookware and tea kettles, up to 4 hours. And then aluminum, soda cans, things like that, water bottles, from 2 to 8 hours. Glass things, drinking glasses, measuring cups, mirrors, windows, up to 5 days, which is quite a bit. Ceramic products, up to 5 days. And then paper, newspapers. It says the length of time varies. Some strains of coronavirus live for only a few minutes on paper, while others can live up to 5 days. So that's a huge variance there. Food, takeout. And now if you go and get takeout, they're doing a pretty good job of non-contacting people wearing gloves, they're wearing their masks, things like that. So produce, what we do is whenever we go to the store and buy something, we have a Clorox wipe. We just wipe all our food products off, whether it be in a can, bottle, food product, bananas, whatever. We just wipe it all down just to make sure. Even though it doesn't seem to be spread through food, that's just kind of what we're doing in our house. And haven't found in drinking water yet. If it does get into the water supply, your local treatment plant filters and disinfects it, so it should kill any germs. So that's good to know. Fabrics, there's not much research. There's shoes. There's been some thought about if you walk, people are sneezing, gets on the floor, the sidewalks, whatever, and you're walking on it, can you transmit it into your house? And so that question is still out there. So it's being cautious all the time. So skin and hair, there's no research yet on how exactly the virus can live on your skin or hair. Rhinoviruses, which cause cold, survive for hours. So it's important to wash your hands for that 20 seconds using soap and water, which is good. And if you don't have water available, then just the hand stuff you can just get in a bottle is good. So as far as protection, they're still talking about 6 feet and maybe a little bit more distancing now. So 20 seconds and then wearing a mask. And we know that the N95s are truly protection. The paper masks are more us protecting other people because they can't stop everything. And so, but it certainly adds a layer of protection. There's eye protection. There's these screens that people can get. So it just depends on your comfort level. So this is the major thing that's still being talked about is, now that the governor has stated any public place you're supposed to be wearing a mask. And so again, that's what's recommended. So this is what I found just yesterday on the State of Oregon site. As far as removing your mask, if it's at home, they talk about untying the strings behind your head and taking off by the loops. Place the covering in the washing machine or throw it away if it's disposable. And so not to touch your eyes, which is a big thing. Nose, again, dry mucous membrane. Mouth, certainly it's a respiratory, so washing your hands. So again, just taking extra precautions and staying healthy is the best way, and trying not to be around too many people at one time is another good way. So this last thing is about contact tracing. So if somebody gets it, then the health department will want to talk to the person. And this is a little bit about what happens with that.
You may have heard the term contact tracing recently, and you're probably wondering what it is. Contact tracing means calling people who may have been exposed to someone who has tested positive for COVID-19. On the call, contact tracers provide information and support to people who have been exposed to COVID-19. It's a key tool for preventing the spread of the COVID-19 virus. In Oregon, local public health authorities, tribes, community-based organizations, and the Oregon Health Authority are working together to stop the spread of COVID-19 with a coordinated contact tracing effort. During a call, a local contact tracer will share information about symptoms to watch for, how to get tested if you get sick, how to prevent the spread of the virus, how to care for yourself and those in your household, and how to connect with resources in your community. Any information you share with a contact tracer will be kept confidential. To learn more about contact tracing, visit our website, healthoregon.org/contact tracing. Together, we can stop the spread of COVID-19 by answering the call.
All right, so as far as vaccination goes, the city provides the Hep A, Hep B vaccine, and so we get that over at Cascade. And so if you haven't been vaccinated and choose and want to be vaccinated, then contact your supervisor and they will get you set up with an appointment over at Cascade. So it's done on work time, so to go over and get the vaccines. So on shot number, day one would be you get the combo A-B shot, and so you get both those. 1 month later, you would go back for the second hepatitis B shot vaccination, and then 5 months after that, you go back and get the second A and the third B, and then that does it. So there's no antibody testing for A, and typically after the first vaccination for A, people have good immunity for at least 8 to 9 months. And so the second vaccine gives you lifetime immunity against hepatitis A. And the same is true for B. Once you get the 3 shots, and then 6 weeks later, you'd go back and they draw some blood and they look for the antibodies for hepatitis B. So then that means you have active antibodies that would protect you if you were exposed to hepatitis B. So, and if your titer test comes back where they can't measure any antibodies, then your option is to get a booster shot of B and then come back again in 6 weeks and then do another titer test. And then if the other option would be then if that didn't work, is to go back and redo the whole series over 6 months and then do another titer test. And if that doesn't take, then it just probably means you're immune to it anyways. And so it's not going to harm you in any way, shape, or form. And so those are covered by the city. And so the city would cover the cost of that and the time to go over and do that. And so it's over Cascades, over by Costco over there. And so it's on 2650 Suzanne Way. Here's the phone number for the supervisors, 541-228-3000 to call if one of your employees wants to get a vaccination. So as far as exposure goes, our typical exposure would be that you would contact your supervisor, and then we would get you medical attention within 24 hours. This is for the hepatitis stuff, especially for B. Again, there's no vaccine for hepatitis C, and so I don't know if they're ever going to develop a vaccine for that. So as far as COVID stuff exposure, we haven't had that as far as I know yet in the city. There may have been one in the police department. So that would be something that would work through the workers' compensation program in the exposure program. Okay, so that does the presentation. I'm going to stop sharing. And does anybody have any questions? If not, we're all done. And thank you for listening.